Hey everyone, I'm going to go ahead and record this last PowerPoint that we didn't get to in class today. So this would be the urinary disorders and dysfunction stuff that we didn't get to. So let's see if we can start with that. Okay, so in this PowerPoint, this first starts talking about glomerulonephritis. So what that is it's a group of diseases that injure a part of the kidney that filters the blood. So we're specifically talking about the glomerulus. This can either be through an attack by the immune system, which typically that's what it is, where you have these antibody-antigen complexes that form that start to cause inflammation inside the glomerulus and it injures it. So it causes the kidney to be injured and it can't get rid of all of the waste like it normally would. So you start to, build up with all of this fluid, and if the illness continues, the kidneys can stop working altogether. So you can get kidney failure from this. So there are two categories of this. So there's nephritic syndrome and nephrotic syndrome. So those are like types of glomerulonephritis. So with nephrotic syndrome, so again, this glomerulus is injured. So it allows all of these really large amounts of proteins to leak into the urine. So you're getting rid of a ton of protein. So the protein that we're talking about is albumin. So you're very low in albumin. So this results in swelling. So usually you'll have it in the legs. You can also have it in the arms and in the face if it's really severe. Although you're leaking all of this protein, you are having increased levels of lipids in your body as well at the time. The kidney's ability to clean all of this extra water and waste materials out of the blood can be decreased. And that's kind of what's going on with nephrotic syndrome. So with nephritic syndrome, again, the glomerulus is injured, but now it's allowing red blood cells to leak into the urine. So the urine can be red or dark brown in color, but sometimes you don't see like visible blood. So protein may also leak into the urine, but not as much as with nephrotic syndrome. So the kidney function is often lower. In severe cases, kidney failure can develop, and urine may not be produced in such cases. So this can lead to swelling and high blood pressure. So again, as far as causes go, common causes would include HIV, hepatitis B or C, lupus. The trigger for some of these cases is not known, so sometimes this could be considered idiopathic, which it happens for no known reason. But usually it's thought to be related to something that causes the immune system to attack the kidneys. So a lot of people think it's autoimmune. Sometimes this will run in families and have a genetic cause. So symptoms of acute and chronic glomerulonephritis. So if someone has this, they are going to have blood in the urine, causing it to turn like a brownish color, kind of like what this picture looks like. They're not going to urinate as much, so they may have some oliguria going on, shortness of breath because they're retaining all of this fluid. They're going to have high blood pressure, fatigue and nausea. They can have rashes, joint pain, or abdominal pain that can be seen at times. So patients with nephrotic syndrome can have the following symptoms. So the urine might look more foamy. This can be seen in people with nephrotic syndrome because of all of that protein loss. That's why it looks that way. You can have ankle, leg, or facial swelling, high blood pressure, and then frequent urination during the night. To diagnose this, a test for protein in the urine or blood is often the first finding that points towards glomerulonephritis. However, because many other problems can cause this, the doctor usually looks at the urine under a microscope. So this can help tell whether the blood or proteins are coming from the glomerulonephritis. Ultimately, a kidney biopsy is often needed to tell for sure if it is this. In this test, the doctor inserts a thin needle through the back into the kidney to take a small piece of tissue. So how they treat this is through diet. Typically, you're going to be on a low salt diet. They try to control your blood pressure with blood pressure medications. Because you are retaining fluid, they're going to give you some diuretics. Um, Sometimes with this, you may require a medication to suppress your immune system in order to get the body to stop attacking the kidneys. So these medications are usually only used for a short period of time until the kidney starts to improve. But often a milder form of these medications is used for longer periods to keep the body from attacking the kidneys again. So usually when people are on something like this is like immunomodulator type drugs. There is something called plasmapheresis that I'm not sure if you guys know what that is, but what it is it's very similar to dialysis. So they hook you up, and instead of your blood going out of your body and them cleaning the blood, they are doing this with your plasma instead. So it's not the blood that they're taking, they're cleaning the plasma and then putting that back into your body. So the idea of this is with this problem that you have these antigen antibody complexes that are stuck inside the glomeruli, and that's what's causing all of this inflammation and problems. So if you can get those out of the glomerulus, then usually that fixes the problem. So that's kind of what plasmapheresis is. And then, of course, if kidney failure develops, dialysis might be the next step as well. So when we talk about acute glomerulonephritis, this develops suddenly. So you can get it after an infection. So I want you, when you're thinking about this, to really think like about strep. So maybe you just had an episode of strep a couple of weeks ago, maybe like 2 weeks ago, and now you start getting these symptoms. So this can develop after that type of infection. Sometimes you start to get better, but then your kidneys start to act up. So the early symptoms of this would be the puffiness of the face in the morning, blood in the urine, and then urinating less than usual. There is a chronic form of this. This can develop silently without symptoms over several years, and then it could lead to complete kidney failure. Early signs and symptoms of chronic can include blood or protein in the urine, high blood pressure, swelling of the ankles or the face, frequent nighttime urination, and then very bubbly or foamy urine. Okay, so then this gets into polycystic kidney disease. So I want to talk about that for a few minutes. All right, so this is the fourth leading cause of kidney failure. Not everyone who has this will develop kidney failure, but I mean, it's pretty common. About 50% of people with this will have kidney failure by age 60. So what this is, it's a genetic disorder that causes fluid-filled cysts to grow in your kidneys. Unlike the usually harmless simple kidney cysts that can't form or that can form in the kidneys later in life, these can change the shape of your kidneys, including making them bigger. Polycystic kidney disease is a form of chronic kidney disease that reduces your kidney function and can lead to kidney failure. Polycystic kidney disease also can cause other complications or problems like high blood pressure, cysts in the liver, and problems with blood vessels in your brain and your heart. So there are a couple of different kinds of this. There's an autosomal dominant polycystic kidney disease, which is usually diagnosed in adulthood. And there's an autosomal recessive one, which is diagnosed in the womb or shortly after the baby is born. So really what causes this is there's some type of mutation in your gene or a defect that causes this. A child usually gets the gene mutation from the parent. In a small number of cases, the gene mutation develops on its own without either parent being a carrier. So this type of mutation would be like a spontaneous one. So signs and symptoms of this, usually people will have pain, high blood pressure is the big one. kidney failure, and then those are the big things, I guess. And then in many cases, um, sometimes people don't have signs and symptoms, so they don't even realize they have it until they have some kind of imaging or something to show these, and that's how they find out. Early signs of this in the womb are larger than normal kidneys and a smaller than average sized baby, a condition called growth failure. The early signs are also complications. However, some people with this do not develop signs and symptoms until later in childhood or even adulthood. All right, researchers have not yet found a way to prevent polycystic kidney disease. However, you could slow it down, um, you know, by trying to keep good control over this person's blood pressure so they don't get further kidney damage. Aim for a blood pressure goal of less than 120/80. Also take steps to help delay or prevent kidney failure. Do healthy lifestyle practices such as being active and reducing stress. Don't smoke. All of those things can help. Just a couple other little tidbits about that. So these cysts can develop inside the nephrons, and healthy kidney tissue is replaced with multiple non-functioning cysts. Usually this is something that's more common in Caucasian patients to have polycystic kidney disease. Um, Other things that maybe I didn't say, I just want to make sure I'm telling you everything here. Sometimes you could see like back or side pain from this, maybe headaches. You could maybe see blood in your urine, urinary tract or kidney infections associated with it. Um, and really, there's no cure for this. So, you know, it's kind of sad because you just try to prolong their life as long as you can. Of course, if you think that you're a parent and you have this, you could get genetic testing done to see if maybe your kids are going to have it. So that could be something you could do. And then some other stuff that I read about this, I heard that sometimes they can do a needle aspiration for drainage of some of these cysts. So like if you had a really big one, because these cysts can be multiple sizes. You can have really big ones and smaller ones, and there are multiple sizes. So if you have one that's getting kind of big and it's pushing on something and causing you discomfort or making you not be able to breathe or something weird like that, they could do that. But there's so many of the cysts that there's no way they could drain all of them. And the fluid would just come right back anyway. So the highest priority then is just blood pressure control and pain control. And then some studies show that avoiding caffeine and increasing your water consumption throughout the day can help decrease the growth of the cysts. So that could be something that this person could do as well. All right, so this last part is about the urinary tract infection. So this shouldn't be too bad because you guys should know a lot of this already. So a UTI is an infection found within the urinary tract, which can be caused by a bacteria, which is most common, or maybe a virus or a fungus. UTIs can be found anywhere throughout the urinary system, which I don't think we always think about. So I want you to think this way when you're thinking about this. So cystitis is inflammation of the bladder. It can be caused by bacteria or a reaction to drugs, radiation therapy, or even feminine hygiene spray. So that would be the bladder, like if you had a bladder infection, that's cystitis. There's something called urethritis. This is inflammation of the urethra. This can cause pain with urination, usually caused by bacteria getting into the urethral opening. So that's what I think we most often think about, is that how you get, a UTI. And then prostatitis is a swelling and inflammation of the prostate gland causing painful or difficult urination. This can be caused by a bacterial infection or by nerve damage even. So those three things are all considered lower urinary tract infections. And then you also have upper um, urinary tract infections that you could get too. So an upper UTI would be considered pyelonephritis. This is a sudden severe kidney infection that causes the kidneys to swell, and it can permanently damage them and can be life-threatening. Usually the cause is because the infection starts in the lower urinary tract and then it spreads to the upper part. Bacteria is usually the typical cause. So with these, you want to make sure that you catch it quick so that you get it when it's in the lower tract, because the minute that it gets in the upper tract, it can go systemic and you can get super sick from this and possibly even die if you don't take care of it the right way. Okay, I just kind of told you all of this stuff, but you fast forward to this. So who is more at risk? So it seems like women are always more at risk for everything, right? So women are because of our anatomy. So the female urethra is shorter than the male's, which allows for easier migration of, stuff to get up there. And also close proximity of the urethra to the rectum. So sometimes people don't wipe the correct way and that's how they get stuff. You would think something that's simple, people would understand that, but you'd be surprised. All right, so our body has certain things in place that kind of help um, prevent UTIs. So these are some of the things that I just listed here. So just, how urine flows downward. So this keeps the urine flowing out of the system and prevents retention or backflow of urine into the kidneys. The urine itself is usually normally really sterile-like, and it has antiseptic qualities to it, so it can prevent bacteria from sticking to the lining of the bladder. Also with males, with their prostate gland, it secretes a fluid that has antimicrobial properties to keep bacteria out. And then with normal flora of women, usually this is present in and around the vagina, and it keeps the area around the urethra acidic, which prevents bacteria from migrating. So that's another thing that our body does. So typically the most common type of bacteria that causes UTIs is going to be E. coli. This is usually from the rectums because someone's not wiping the correct way. Other things that could possibly cause a UTI would be hormone changes. Sometimes you get them when you're pregnant, menopause, birth control, antibiotics. Sometimes they'll change your normal flora of your body, so it causes you to be more apt to get sick. Kidney stones can cause a blockage, and then the urine just sits there and it can't drain. So you're going to get bacteria that forms there because of that. And then diabetes, compromised circulation. You have that when you have diabetes. So it means that it's a breeding ground for bacteria to flourish because, you just can't fight off infection like you normally would. Toiletries, if you do excessive bubble baths or perfumes or tampons and sanitary napkins, some of those things can cause it. Like if you leave in a tampon for too long, that can totally cause you to have a UTI. Obstructive prostatic hypertrophy or BPH. So the urethra is surrounded by the prostate gland, and if the prostate gland becomes too swollen, it can close off that opening to the urethra, and it can cause them to retain urine and end up with a UTI. So that's very typical. And then vesoureteral reflux. This is common in pediatric patients when urine from the bladder backflows into the kidneys. So usually it's a congenital thing, so they would have to do something to fix that. Other causes, overextended bladder. So like if you hold your urine for long periods of time. Indwelling catheters, of course. Decreased immune system like we already just talked about. So if you think someone has a UTI, some of the things that they typically do, they'll do a UA, But the urine culture is the main thing that's really going to help you figure out if this is what it is. So typically, they have like a petri dish, and they put a specimen of this urine on the petri dish, and they see what grows over a certain period of time. So they look at it in 24 hours, 48 hours, and then 72 hours. And then that's going to show what bug this is, and so they'll know exactly how to treat it. Cystoscopy is another thing they could possibly do. They actually put a camera up into their bladder to look around to see if there's any problems in there. I've actually had that done before in the office. um, so with that, you can have some bleeding afterwards if, you know, because of the trauma of putting that up there. But typically, I mean, it's a good way to see if there's any big issues because you can actually see because you're right there. So I think we all kind of know some typical signs and symptoms of urinary tract infection. So pain when you urinate, so burning, persistent need to void, but not a lot's coming out, strong odor to the urine, cramping in the abdomen or pain at that costovertebral angle, which we said was kind of between the shoulder blades, spasms of the bladder or urethra. Oh, do those hurt? Because I've had those before. Fever, increased white blood cells. And then this is something I really want you to pay attention to because you probably will guarantee have a question on this. In the geriatric population, confusion and sudden increase in falling and agitation are typically seen rather than typical signs and symptoms like what we just talked about above. So you may not understand why this person is all of a sudden falling and stuff, but then when you bring them in, they'll do a UA or a culture, and then they'll find out they have a UTI. So this is definitely something to pay attention to. Okay, so some of the things that we do for, you know, someone with a UTI. So we try to catch it quickly, again, like I said, so it doesn't get up into the upper urinary tract. We want to maintain their fluid status. We want to keep a real close eye on their intake and output. We want to see that they're putting out at least 30 milliliters an hour. Control their pain. Maybe they can do warm sitz baths or a heating pad. You could do Tylenol or NSAIDs. And then pyridium is a great medication. I've taken this before. It helps with those bladder spasms, and it just totally makes you feel so much better. But it changes the color of your urine. It makes everything orange, like bright orange, and it could stain your clothes and stuff. It's crazy. But what this does is it coats the bladder wall and urethra to decrease those spasms to help with that urinary frequency and burning. So great drug, it helps a ton. Other things we're gonna do, we're gonna, of course, give them antibiotics, right? So some of the things that we tend to go to are Bactrim. That's a big one that we usually choose. And then I see Cipro a lot. So we want to educate patients about consuming lots of liquids if they can. So 2.5 to 3 liters a day, if at all possible, unless it's contraindicated with them. Also, we want to collect the urine culture before starting the first dose of antibiotics. And then even if the person doesn't feel like they have to go, we want them to try to go every 2 to 3 hours if they can, because that's going to help clean things out really good. If they have an indwelling catheter, we want to remove it as soon as possible, because the longer those stay in, the more at risk they are for infection. And then as far as education goes, don't stop your antibiotics before you're supposed to. Take them the whole way through, even if you feel better before you're done. Because if you stop it too early, you can get this infection back, and then it's going to be harder to get rid of because you didn't take all of your antibiotics like you were supposed to. Make sure we educate people on wiping front to back, because boy, people sure don't know how to wipe correctly because we have so many UTIs, right? Urinate immediately after intercourse. That's another thing people can do to help, keep them from getting this. Avoid wearing tight pants or underwear. Make sure you have like cotton underwear, because that usually helps. Avoid bubble baths, powders, and perfumes to the genital area. change sanitary pads often and avoid tampons if you can. Avoid caffeine and alcohol because they can irritate the bladder. And then make sure you void every 2 to 3 hours because that's going to help. So those are the main things I wanted to go through with this. So as you can see, when you go through the chapters, there's other stuff in the chapters, like it talks about, you know, the different types of incontinence, stuff like that. So you remember, I did have one of you guys do a presentation on that. So even though I didn't go over that in PowerPoints, that's still, fair game to look at that kind of stuff as well. So remember, when we have our next test, this stuff that we just went over, all of this renal stuff, that will be half of the test. And then the next half of the test will be what we go over next week, which would be hypertension and vascular disorders. So it'll be like half and half of that. So if you have any questions, let me know. Hopefully this helped.